Without further ado, let me introduce you to Dr. Barbara Hanna, who's going to be talking about menopause care.
Hello, everyone. I'm Dr. Barbara Hanna. I am a certified menopause specialist and a gynecologist. And today I am going to talk to you about menopause care and present to you a women's journey to midlife wellness. I am the founder of MyMenopauseRx, which is a digital health company devoted to menopause care. So this is just a little bit about me. And in my objectives of today's talk are threefold. As a gynecologist, as a menopause specialist, and the founder of a digital health company, the doctor in me feels compelled to introduce you to some common menopause symptoms. I'll present the need for telemedicine solutions for menopause care, and I'll define the elements to a satisfying digital patient care journey. So all women experience menopause, either naturally or surgically, and menopause itself is not a disease. It's a time and a period of life where the natural process of aging takes over in women. Women are living longer, they're spending over a third of their lives in perimenopause and menopause, and access to menopause care is clearly a path to healthy aging. And so it's well documented that better health during perimenopause and menopause can decrease a woman's long-term health risk for chronic disease later on in life. And so as you can see on the slide, high blood pressure, diabetes, obesity, anxiety, depression, osteoporosis are all chronic diseases that women have an increased risk of once they enter perimenopause. In addition to that, there's racial and ethnic disparities, and each woman's menopause journey is completely unique. No two are alike. And sadly, women of color enter perimenopause and menopause earlier. And those women that experience menopause earlier have an increased risk of chronic disease and longer through their lifetime. So for today's presentation, I thought it would be interesting to walk through a traditional menopause health journey that too many midlife women are experiencing. I will then show you how the digital menopause clinic, MyMenopauseRx, transforms that journey into something empowering for women. So meet Michelle. She's a 48-year-old female with regular monthly periods. And so Michelle has not been sleeping well for 2 years. She has hot flashes during the day, but denies any night sweats. Her weight has been creeping up, and most of it seems clustered in her belly. She's short-tempered and moody at times. And lately, Michelle has noticed that she's more forgetful, she's foggy thinking, and she finds it more difficult to concentrate. She's really afraid that her boss may take notice at work that it takes her longer to complete tasks due to her brain fog. Michelle's active. She exercises daily by walking her dog around the block. And she admits that she cooks on weekends, but brings in takeout during the week because between caring for her family and her parents, along with her busy work schedule, she can't seem to find time to cook at home. And so we talk about symptoms. Greater than 75% of women suffer from menopause symptoms. And unlike our thought process in the past, we now know that symptoms last on average 7.4 to 10 years in women. And 33% of women have symptoms that are severe enough lasting greater than 10 years. And the biggest thing I'd like to point out is that menopause is not a disease of women in their 50s and 60s. The menopause transition begins in a woman's early 40s for many people, and that is the time where these changes are taking place in their body. So back to Michelle. After an exhaustive internet search, Michelle suspected her symptoms were due to perimenopause. Michelle admits she's not been to a doctor since the birth of her last son 8 years ago. As a working mom, she's just too busy to make time for herself, and she prioritizes her work and her family over her own self-care. So looking at the typical health journey that women experience, there's a lack of scheduling of appointments that are on demand. There's long wait times for new patient appointments. The average is 24 days. And with the time that it takes to go to and from work or to and from home, and then waiting in the office, an average of 59 minutes, all for the average of spending 18.21 minutes with a physician. So Michelle turns to the internet again to find an OBGYN near her, and she's redirected to its practice website, but she's completely disappointed that she can't book online and forced to call the office. So the following day, while she's at work, she calls the office to schedule, and she's sad to learn that the first available appointment is 18 days out, and worse, it's in the middle of her workday, forcing her to miss work. So she arrives at the office 15 minutes early as requested to complete her intake forms, and she sits in the waiting room for another 20 minutes before she's ushered into the exam room, where she waits again for 15 minutes before her new doctor arrives. Her new doctor goes through her medical history, looks at her review of systems, and completes her exam. She recommends standard wellness testing, and she informs Michelle that menopause is a natural transition and most women suffer and manage just fine. Michelle's sent on her way, frustrating and feeling dismissed. And the sad fact is that most physicians, OBGYNs and primary care physicians, get little to no formal medical training treating perimenopause and menopause. And so Michelle goes back to the internet, her source of information, and she finds MyMenopauseRx, our digital health clinic for menopause care and midlife wellness. And after work, she creates an appointment. She appreciates the choice to use her health insurance or pay a fixed, transparent, out-of-pocket fee. She completes her medical intake and menopause questionnaire, and immediately she feels validated that her symptoms are going to be addressed. The MyMenopauseRx proprietary technology uses integrative health histories, validated health screeners, and menopause questionnaires, which will enable the future use of artificial intelligence to help guide evidence-based risk and medical decision-making. So Michelle logs onto her HIPAA-compliant dashboard the following day to begin her appointment. And at MyMenopauseRx, the HIPAA-compliant dashboard serves as the woman's command center for her menopause care, putting all the needed resources right at her fingertips. The dashboard contains unlimited messaging to the clinical staff, integrated video visits. You don't need to launch a separate program to launch your visit, personalized visit summaries, the ability to self-order lab testing on demand, all of her lab results with review comments, and point-of-care payment systems. So later that day, Michelle's chatting with her girlfriend about the ease and convenience of her online menopause visit, but sadly, she can't remember a thing that her specialist recommended to her. The reality is, even with the clearest of mind and no menopause symptoms, it's well documented that 40 to 80% of information provided by healthcare providers is forgotten immediately by patients. And so access to education is key to help improve wellness and self-care. And so downloadable personalized visit summaries that include education, lifestyle, supplement recommendations, and medication treatment options are readily available on the woman's dashboard at MyMenopauseRx. She's even encouraged to share her information with her primary care healthcare provider. So 8 weeks later, Michelle is enjoying improved sleep and concentration. She admits she hasn't felt this great in years, and she now feels empowered. Michelle's making a commitment to improve her self-care. She's learning and taking the time to cook at home healthier meals. She's increasing her exercise, and she's on a path to improving living. And so MyMenopauseRx is the journey to midlife health and wellness for women. Treating menopause and improving the health of midlife women is so much more than just writing a prescription. It's focusing on the whole person, lifestyle, mind and body. It's essential to help midlife women to find their path in health and wellness. The MyMenopauseRx digital menopause clinic is helping women feel better to live better. Suffering is out, menopause care is in. Thank you so much. I look forward to your questions later.
Thank you so much, Barbara. That was amazing. And I think it's so important we talk about menopause more. And I think showcased in that presentation, we need to meet women in their homes and like really increase that access to education. So thank you. That was really insightful.